Okay, now we're here. So again, X-rays and what we can see on chest imaging and on CAT scanning. So when you compare the previous chest X-ray and compare it to this one, you see there is more white stuff here than on the previous one that you saw, and this white stuff doesn't belong there. And when we do a horizontal cut through your chest with a computer tomogram or a CT scan or CAT scan, you see the corresponding section through your lung on the right side here. When we look at CAT scan images, imagine that we're standing at your feet and looking up to your head. So this is your right side, this is your left side, and this is your right side. And in the middle, we have your heart. Normal lung tissue looks like this black area up here. And this white stuff here all doesn't belong there. And in this case, this is actually blood that has filled the lungs in a patient with active vasculitis, either GPA or MPA, who has alveolar hemorrhage, bleeding into the alveoli of the lung. And that is an acutely life-threatening situation that needs to be treated quickly and definitively. Now, again, more CAT scan images. And when we look at the images on the left side first, on the left upper panel, you see a patient who has all these small round shadows or white spots. So sometimes they're referred to as white spots. We call them nodules because they're round and they're essentially horizontal cuts through little spheres. So these are round little balls in your lungs that are nodules, okay? And when we treat the patient adequately, they go away completely, like you see here on the right side in the same patient 6 months after treatment start. Another situation, a different patient on the left lower side here, sometimes these nodules are bigger. And when they get bigger and get access to an airway, the center that often contains what we call necrotic material or dead tissue because it hasn't gotten enough blood supply. If it has access to an airway, it can get coughed out, and then you have a hole in the middle, which we refer to as a cavity or cavitation. And here, same thing, there's a cavity or cavitation, and there is some liquid in this cavitation, so that's why you have this air fluid level. So this is a mass lesion with a cavity. This is a nodule, and this is larger than 3 centimeters, so it's also a mass with a cavity. Good thing is, after successful treatment, these resolve completely, and they may leave behind a tiny scar like this here, or this here. And these tiny scars are functionally not relevant. The rest of the lung is normal, and the lung function is back to normal. Even though these are big lesions initially, the lung function remains normal, and these lesions can essentially completely disappear, only to show a little scar there.